Good afternoon, everybody. My name is Reynald Pagio, and today I'm going to be showing you how to insert a nasogastric tube on a patient. Got it right here. It's also known as the Salem sump. Okay. Very first thing I'm going to do is go into my computer and open my patient's chart and verify that the order is in. All right, John Smith. Date of birth 4/1/1969. I got an order here from Dr. Oz to insert an NG tube. While I'm in the patient's chart, I'm going to go ahead and open up the LabWorks. So I want to make sure that coagulation levels are within normal range. And I'm also going to check that I'm going to verify that there isn't any coagulation therapy going on right now. Not everything seems to be in order. I'm going to go ahead and perform hand hygiene, okay? Okay. Now that I've performed hand hygiene, I'm going to gather my supplies prior to going into the patient's room. I have here the NG tube itself. I have a tongue blade or tongue depressor. I have some lubricating jelly, some silk tape, and pen light. I have a basin of water and a Toomey syringe. I'm gonna go ahead and gather my supplies and bring it with me into the patient's room. As soon as I walk into the patient's room, I'm gonna draw the curtains. Especially if they're in a semi-private room, you want to provide privacy for your patient. And the first thing you do is introduce yourself to the patient. Mr. Smith, my name is Ray, and I'm gonna be your nurse tonight. Do you mind if I verify your name and your date of birth? So, John Smith, April 1st, 1969. And also, if possible, I'm going to go ahead and verify the medical record number on the patient's wristband. Now that we've determined that we have the right patient, I'm going to explain to the patient what we're about to do. Mr. Smith, I just received an order from Dr. Oz to insert a nasogastric tube, an NG tube as we call it. What that does is it's going to help me suction secretions from your stomach. It's going to go in through your nostril and down to your esophagus, all the way down to your stomach. Do you give me permission to continue? Assuming that the patient agrees, we're going to go ahead and continue. Okay? So, Mr. Smith, I'm going to try to explain everything that is happening as we go in detail so that you know what's going on. Okay? If you have any questions, please do not hesitate to stop me and ask me, okay? So now I'm going to start setting up my supplies. If there's a side table or maybe a Mayo stand, I'm going to go ahead and use that. Open up my supplies. Okay, my pen light. All right. So now, Mr. Smith, I'm going to have you sit up for me as high as we can. If I have an extra pair of hands, I'm going to have them come into the room, introduce themselves. Now they can help me reposition the patient and have them sit up. The ideal position for the patient would be in a high Fowler's position, sitting up. Some patients may not be able to tolerate sitting up that far. Maybe from a high all the way down to a semi-Fowler's would suffice. So now that the patient is positioned properly, I'm going to explain further to the patient what we need to do. Mr. Smith, as I said before, this tube will go down and through your nostril down to your stomach. I'm also going to have to assess your swallowing and your gag reflex. The way that we do that, I'm going to give you a cup of water with a straw. I'm going to go ahead. You could go ahead and take a sip and swallow that. And the way that I check your gag reflex is I'm going to have you open your mouth, stick your tongue out for me. I'm going to press down the back of your tongue with this tongue blade. I'm going to use the pen light so that I can see what I'm doing. You don't want to poke in there, prod in there blindly. So I'm going to go ahead and do that. Gag reflex seems to be okay. All right. So now that we've done that, we're also going to check the patency of each nares. Prior to doing that, since we're going to be going in through the nostrils, obviously it's going to be affecting airway. we want to make sure that the patient doesn't desat. The way that we do that, if the patient doesn't already have a pulse oximeter on, we're going to go ahead and apply it. Mr. Smith, this is a pulse oximeter. What it does is it measures your oxygen saturation. While we're doing this, since I'm going through your nose, I want to make sure that you don't start desatting or desaturating the oxygen as we're going through. If you do, I'm going to have to stop and make sure everything's okay first. All right, so now that the pulse oximeter is on, I'm going to measure my NG tube to see how far down I would need to go. The way that we do that is on the patient. Okay, we would, the end that's actually going to be inside, we're going to start from here into the nostril. We're going to measure it down to the earlobe, as so, and then down to the esophagus, down to the xiphoid process. That's right about here. Now I'm going to add about 10 centimeters just to make sure that we reach the stomach. So about right here. And the way that I mark that would be using tape. About right here. Okay. So what this marker does is it tells me when I've gone far enough in. So as this comes closer to the nostril, I know that's where I'm gonna need to stop. Okay. Now, determining the patency of the nares, Mr. Smith, using your finger, I'm gonna need you to press down on one nostril and then blow out the other, and then again on the other. Okay. In my case, my left nostril is more patent, so let's assume it'll be the same for the patient. Now that we've done so, I'm gonna continue to set up my field. Put some lubricating jelly. Okay, and I'm gonna put some clean gloves on. Mr. Smith, I'm ready to begin. Whenever you are. Okay, patient says we're good to go. Okay, I'm gonna go ahead and put some lubricating jelly on the tip. This is gonna help facilitate sliding in as I'm inserting. Okay, so now I'm gonna go ahead and start inserting to the patient's nose. Now that once I reach about the nasopharynx area, I'm gonna have my assistant hold the tube in place and advance it just a little bit more, and I'm gonna have Mr. Smith open his mouth, and again using my pen light because you don't want to prod in there blindly. I'm gonna check to make sure that the tip of the NG tube is not coiling and it's actually going down at the right place, going down the throat. So now that I've done that, everything seems to be at the right spot. I'm gonna go ahead and continue to advance. Mr. Smith, this is not a time that I need your help. Okay, I'm gonna need you to put your chin down to your chest, and then as I tell you, I'm gonna need you to take some sips through the straw, and as you swallow, I'm gonna push down, and it's gonna help facilitate sliding down. Okay, ready? All right, keep swallowing. All right, now swallow, 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 swallow. All right. So now that when we reach this area, say the nostril is about here, I know I've reached further enough. I'm gonna verify that I'm at the right place. If I hear air escaping from here, I know I'm at the wrong place. So now that there is no air escaping, I know I'm at the right place. I'm gonna go ahead and have my assistant hold it in place, and we're now gonna secure that. The way that we do that is by taking a strip of tape. We're gonna split it long ways, so about there, and then we are going to place this end on the patient's nostril, like outside the nose, right, like that. We could also use tincture of benzoin. It's like a glue that will help with the tape adhering to the skin a little better. All right, so now that this is on the patient's nose, pretend this is the nostril where it comes out. I am going to place a tape here, and then in a spiral motion, start with one end. We're gonna go in and come around, and then the other side. Okay, we're gonna loop it around, spiral, and now the tube is secure. All right. So now imagine this thing is down there and this tube is just sticking out of the, the patient's nose. You can get pretty uncomfortable, and it's obviously in the field of view. If they were eating, that's going to get in the way. We can go ahead and tape that on the side of their cheek, going down towards the nose, and then tape it down here, and then you can tape it down or clip it down onto the patient's gown. Now everybody has to be mindful. Everybody that helps you take care of this patient needs to be mindful that there is an NG tube there. Imagine, pulling the patient's gown off and this thing is taped onto it. It'll obviously pull it right out. One other thing we need to do is you can actually use your marking tape. All right, I'm gonna put my initials and time, the date and the time on here. Okay, and then also I'm also going to mark the other end and do the same. I'm gonna put my initials and the date and time, and put NG2, so everybody knows what that thing is that's sticking out on the other end. All right. Another one way to verify placement is I'm gonna take my 2mm syringe, empty, and I'm gonna go ahead and draw back, aspirate some fluids. Now, if I aspirate some gastric contents, then obviously I'm at the right place. I'm gonna go ahead and bring that right back in there. At least I know I'm at the right spot already. And also I'm gonna tell the patient that, Mr. Smith, there's a possibility that Dr. Oz might want to confirm the placement. And the way we do that is using X-ray. We would X-ray down in your chest, and it would see how far down the tube is, and to make sure that it's at the right place. But that's up to Dr. Oz if he would like to order that. Okay. So now that everything is in, the tube is secure. I'm gonna place the patient back down at his desired position. Make sure everything is comfortable. Mr. Smith, if you need anything else, or if there's anything else that I can do to make you feel more comfortable, please let me know. I'm going to give him the call light. All right. Mr. Smith, again, if you need anything, don't hesitate to press that call bell. Meanwhile, I'm going to go ahead and do some charting. If you need me, press that call bell and I'll be in here, or one of my coworkers will be in here to help you. All right. Hey, do you have any questions with anything? And assuming the patient said no, and they're comfortable, I think we're all done. I'm gonna gather all of my used supplies and dispose of it, and perform hand hygiene after I take off my gloves. All right, and that is it.